Bismillahirrahmanirrahim. The concept of site-specific regeneration, specifically in the lung tissue, is discussed in this video. These are the references for this video. The respiratory epithelium has got a limited regenerative capacity depending largely on preservation of the extracellular matrix. The superficial injuries such as mild infection or irritation of trachea and bronchi are healed mainly by regeneration of adjacent intact epithelial cells. The exact progenitor cells are not fully defined. The possible contributors are bronchoalveolar stem cells, type 2 alveolar epithelial cells that are important progenitors for the alveoli, and there is potential role of bone marrow derived stem cells. The outcome of the injury in the lung tissue depends mainly on the degree of epithelial and stromal injury and integrity of the basement membrane framework. So what is the mechanism of alveolar injury with intact basement membrane and what is the outcome? So infection, shock or toxicity by the oxygen leads to injury of the alveoli, and there will be necrosis, and uh, there will be early response by inflammatory exudate that is rich in the plasma protein. Neutrophil will join this environment along with macrophages, and exudate will be cleared, and there will be attempt for the healing or regeneration. If this exudate is not cleared, there is organization of this exudate by granulation tissue and onset of intraalveolar fibrosis, and type 2 alveolar pneumocytes, they migrate to the denuded area. These type 2 pneumocytes, they divide to form cells with features that are intermediate between the type 1 and type 2 pneumocyte, and these cells then cover the alveolar surface and establish epithelial contacts. And once the epithelial contact established, this mitosis process is stopped and cell now differentiate into type 1 pneumocyte. So if the basement membrane is intact, there is complete regeneration of these uh, defects. So whenever there is an alveolar injury with disrupted basement membrane, uh, there is onset of cellular responses. The mesenchymal cells from alveolar septae, they proliferate and they differentiate into fibroblast and myofibroblast. The macrophage play their role as they release factors that stimulate fibroblast proliferation and also promote fibrosis. The fibroblast and myofibroblast, they migrate into alveolar spaces and produce extracellular matrix such as type 1 collagen and proteoglycan. So as a result, there is pulmonary fibrosis that results in stiff and non-functional lung tissue. One example of this scenario is emphysema, that is one of the chronic pulmonary obstructive disease. It involves enlargement of air spaces and destruction of the alveolar wall. There is ineffective replacement of the elastin that result in irreversible tissue damage and permanent loss of the lung elasticity and function. So this is a lung alveoli that is lined by the pneumocytes, type 1 and type 2 pneumocytes, and there is intact basement membrane. In the down in the beneath this basement membrane, there are some fibroblasts that are present, and this is the blood vessel. This is the normal lung alveolar structure. If there is acute inflammation with preserved matrix and basement membrane, there is a regeneration of the normal lung by the pneumocyte. Type 2 pneumocyte, they transform and into type 1 pneumocyte. They proliferate, divide, and then differentiate into type 1. While if there is extensive damage to the tissue along with basement membrane damage, there is attempt to the epithelial remodeling, but eventually there will be fibrosis of that area with the loss of the normal architecture. So here you can see that the area is replaced by the fibrous tissue with these blood vessel formation. So this is interstitial fibrosis. So this is the histopathology image of the lung tissue showing pulmonary fibrosis. There is an HNE stained lung section, and alveolar spaces are markedly reduced or distorted. They are replaced by dense pink stained fibrous tissue, and the normal thin alveolar walls are no longer present in large areas. There is marked collagen deposition within this interstitial spaces that is a hallmark of fibrosis. The remaining alveolar spaces, these are a few alveolar spaces, they are distorted and irregularly shaped. A few inflammatory cells with these dark blue small nucleus are also seen, they are also present. The architecture of normal lung is no more visible and it is mostly replaced by fibrotic tissue, severely compromises the gas exchange capacity of the lung. So this image demonstrates advanced pulmonary fibrosis that is evident by extensive collagen deposition and loss of normal alveolar structure. That explains the impaired lung function that is seen clinically. It corresponds well to chronic interstitial lung disease such as idiopathic pulmonary fibrosis, interstitial pneumonia, or severe healing response after alveolar injury. Thank you for watching this video. If you have any question, please write in the comment box.